Oh, that's interesting. Okay, the information contained in this presentation is evidence-based research. That is great to know, and it's for educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider prior to self-medicating or consuming or ingesting, taking any other medications, supplements, products without discussing with your healthcare provider. Never delay seeking medical advice due to any information that you read in this presentation or anywhere else, and that includes social media, Facebook. Oh, everybody always comes back and talks about Facebook, and our friends and family because they offer so much good advice. Keep in mind that information about cannabinoids is constantly emerging. Therefore, there may be more updated information from the last update found here. Also note that as you go through these slides, you're going to see that a lot of words like may or there's an association with, we don't have a definitive conclusion that, A causes B, or that I think we have more the A causes B than we do A assist with lessening B. So there's a lot more research that needs to be done. We need to have larger audience, larger participants in the study, and just more of it. So, as promised, cannabinoid is a chemical compound or substance found in the cannabis plant. There's like more than 480 different cannabinoids, like that we know of now. There'll probably be more as we find more. The two of the most popular ones that we're going to spend most of the time on in here is THC, which is delta 9, which is your cannabis, and CBD. And both of them kind of have different areas of the brain that they stimulate. Cannabis is a part of the plant that produces 3 types of flowering species. The plant can be ingested raw or made into different forms like powder. Probably the most common is the brownies. Um, Cannabis, also known as weed, pot, marijuana, reefer, bud, THC, delta 9. THC or delta 9 tetrahydrocannabinol. It's the main psychoactive compound of cannabis. And then we have our CBD, which is the cannabidiol. It's a non-psychoactive compound of cannabis. There are others, and there's going to be even more than what I mentioned here, and they're just constantly emerging. One that a new cannabinoid or a cannabinoid that is really starting to come in the foresight is delta 8. It's less sedating, and there's some really good research and some really good things that we're finding about delta 8. Delta 10, I don't know that much about. Delta 0, we don't want to, we want to stay away because it has the most side effects. There's an increased high. People are very high or psychoactive for a good amount of time. And then if any of these things are laced, it just makes it that much worse. Laced means covered. So if we have like cannabis or you have your THC and somebody's put fentanyl on it, that just makes it so much more potent and there could be so many more side effects. So you have to really be careful about where you're getting your supply from. And it's much safer to go to a dispensary. There's also CBG and CBN, which are great anti-inflammatories. So they help out with pain and decreasing inflammation. They also are good antioxidants that help like just within our body and health and well-being. There's CBC, CBB. And there's a lot of others. They just keep coming. So insomnia. According to DSM-5 definition and criteria, it's the recurrent poor sleep quality or quantity that causes distress or impairment. It's important areas of functioning plus the following. So, gotta have these following. So, unhappiness with the quality and quantity of sleep. It includes falling asleep, staying asleep, or you wake up early and you can't get back to sleep. Difficulty sleeping needs to be at least 3 times a week and present for at least 3 months. The problem occurs despite ample opportunity to sleep. The difficulty cannot be better explained by other physical, mental, or sleep-wake disorders, and the problem cannot be attributed to substance use or medications. So the question, do cannabinoids assist with insomnia? Now keep in mind you've already tried other alternatives, psychotherapy, sleep hygiene. Sleep hygiene simply no TV on, all electronic devices off. I tell people to take their cell phones and turn them upside down. If you're using them for alarms, I get it, but turn it upside down so there's no light. Make sure you don't have any captives or whatever on your phone, because then what happens is every time somebody messages, a light flashes. So you don't want any of that to happen. What is the replacement treatment plan for cannabinoids? There can be for insomnia. So delta 9 THC cannabis, it's especially when we look at the indica strain, it may help to promote somnolence and decrease insomnia. There was some research that was done where they used 2 to 3 grams. They were smoked daily, or 5 to 10 milligrams per day using drops. So people were trying that to see if it would help them fall asleep. And for some people it did, some it didn't. They also used it with the medications that they were originally prescribed. Now, some people will come to us and they'll come after they've already taken some of the medication, and others will come prior to going to, to someone for the sleep medication. So it happens on either end. To me, I still think you need to let your provider know. So this is interesting. If insomnia is driven by anxiety, then taking the CBD for sleep really helps because it'll kind of calm you down too. Sometimes we find that people need more than 100 milligrams at bedtime because they really need to stop their racing thoughts. But you still need to start with 15 to 30 milligrams. You should also take that at least 2 to 3 hours prior to going to sleep, and then you can increase it until you find the right dose. 1-to-1 THC to CBD. There's capsules or edibles at the lowest dose is really recommended. The effect takes longer, which is actually great because you don't wake up at night. But, it'll last longer. So what you need to do is, take them a couple hours before you're planning on going to bed, or before you normally go to bed, or at least you try to go to sleep. And hopefully the effect will last a lot longer, but you need to figure out your dosage. Just because your friend takes 2 of them a night doesn't mean that that's what you should take. You might have trouble getting up the next morning. So again, be careful, find your dose. Check with your healthcare provider. I can't say that enough. Whether you're on other medications or not before you add these. And another thing, if CBD or THC is given after discussion with the prescribing providers of any of the prescription medication that's being taken, then you want to make sure that you follow the following principle, mantra, whatever. Dr. Kogan, he kind of adds the second part, but I always say start low, go slow. I believe he says start low, increase slowly. And then he adds a stop when you get to where you need to go. So that's kind of cool. The other thing to look at is the indica strains. So, when we look at 3 strains, we look at indica, sativa, and then a hybrid. Indica, it can have some depressive qualities that might make you feel unmotivated. If you're going to sleep at night, then that's one thing, but you obviously would have a harder time taking the indica, which some people do. Big thing, monitor. CBD can make insomnia worse, especially if the timing is not right. CBG, don't take that anywhere near bedtime because CBG is very activating, meaning that it's going to energize you. When taken alone or with prescribed medication, so it doesn't matter if it's alone or with prescribed medications, but again, you need to let your healthcare provider know. Here's some medication interactions, even melatonin. So most people will kind of pull out the melatonin. I'll try that. And when you mix that with THC or CBD or both together, it has an additive effect, meaning it's going to build. Um, so respiratory depression is one of the side effects, which means that it could stop breathing. You could stop breathing by taking two of them together or three of them together. Another thing, the next thing that a lot of people try, if melatonin doesn't work and you've tried all the increase in milligrams, then they usually go to hydroxyzine. If we add a hydroxyzine to THC or CBD, again, it's the same thing. It increases additive effect in respiratory depression. Trazodone also does the same thing. So one of the things that you could do is just keep the doses low for both drugs, and then it will kind of decrease that additive effect. Okay, let's talk about depression. According to DSM-5, there's 5 or more of the following symptoms have been present during the same 2-week period and represent a change from previous functioning. At least one of the symptoms is either depressed mood or loss of interest or pleasure. So again, 5 or more of the following symptoms during 2-week period of time. So they're depressed most of the day, nearly every day. The person has marked interest or pleasure in doing anything, any kind of activity, so they just stay at home. Significant, like about 5% of body weight in a month of weight loss. They're not dieting. There's nothing else going on with them. Or they have weight gain with an appetite change. Insomnia or hypersomnia nearly every day. So they have trouble going to sleep or they just sleep all the time. Psychomotor agitation or retardation nearly every day. So they're just very agitated. Fatigue or being tired, no energy. Feelings of worthlessness or excessive or inappropriate guilt. They have diminished ability to think or concentrate because they're not sleeping. They can't make a decision, and that's nearly every day. Recurrent thoughts of death, not just fear of dying. Recurrent suicidal ideation without a specific plan, or suicide attempt or a specific plan for committing suicide. So having this stuff, and of course, the last is the biggest thing, and that's the person that you really, I mean, you have to keep an eye on all of them, help all of them, but they're the ones that we really need to keep a closer eye on. So can cannabinoids help these cannabinoids? Is there a place for the cannabinoids in this treatment plan? So CBG, as we just talked about, is great. It's activating, or delta 9 THC cannabis, especially if we use the sativa strain, can assist or may assist with decreasing depression when taken with the prescribed medications that your healthcare provider wrote for you. Now, there's some dosing. When they did the research, they were looking at THC smoking at 2 to 3 grams daily, which is a lot. It's not really preferred. Or CBG, 3 to 5 milligrams sublingual. The max would be 10 to 25 milligrams daily. You can actually separate it out, take it twice a day if you want. Doing it orally, tincture is easier to dose because you can figure out the dose a lot easier. You can decrease it, increase it. So start sublingual, which means under your tongue. It's more predictable. The THC would be 0.5 to 2 milligrams 2 times daily after addressing sleep issues, if there are any. So if it turns out that there's some sleep issues, we might have to address that first before we add the THC in. And always check with your provider. And there's the picture. Make sure that you're monitoring, monitor. And remember, we said about the CBD, it's very activating, so you don't want to take that close to bedtime because it's just going to make the insomnia worse. Might be helping the depression, but it's making the insomnia worse. So If there's no improvement of depression, but instead we now have anxiety and psychotic symptoms, a lot of times this is because of the THC. So you want to look for that. If they start to say they're seeing things, or all of a sudden their anxiety is really increased, then make sure, and it's more than 50% of the people taking THC this happens to. So you're going to have to get on to stop the THC. And that's why we always say start low and go slow, because a lot of times if we see these side effects, it's easier to just say, okay, you have to stop it. Closely monitor for worsening of the depression when the THC is combined with CBD. So there was some studies that showed that when they taken together, THC and CBD actually does increase depression. So, you have to keep a close eye on these people, especially with the depression and trying to get them to feel a lot better. So let's talk about the medication. So normally with depression, we give people antidepressants like sertraline, which is also Zoloft. Fluoxetine is the Prozac. Escitalopram is the Lexapro. Citalopram is the Lexa. And then there's good old Paxil. And if you mix them together, again, you have the same thing that we talked about before, that it increases the additive effect. Respiratory depression, you could stop breathing, but most of the time it's as the doses get higher. So with the antidepressants, with the additive effect, it's worse with the higher doses of the antidepressants. I mean, a real big solution is just like what we talked about before. Use a low dose for the antidepressants and cannabinoids if you're taking it. Just low dose both. So let's look at bipolar. Bipolar is a very interesting topic. Um, Very interesting diagnosis. Sometimes it's hard to find or diagnose. You have to really listen to your patient. And I know, so I've been a family nurse practitioner for 23 years. Then I went back and got my psychiatric mental health nurse practitioner 4 years ago. It's been great to have both because I can look at both, right? But even with that, it's been hard to diagnose bipolar. Some are easy, and you'll see, and I'll show you what I mean. But some are a little bit harder to determine. Somebody who has a lot of mania, a lot of energy, that's usually pretty easy. So, by DSM-5 definition, to be diagnosed with bipolar disorder, a person must have experienced at least one episode of mania or hypomania and have had a major depressive episode resulting in depressed mood or loss of interest or pleasure in life. So when we look at mania, what is it? It's elevated, expansive, irritable mood, and they have to have that for at least a week and be present nearly every day. Or they might have hypomania, or some people will have both, right? Or they'll have hypomania, which lasts 4 consecutive days. They must be present most of the day, every day, almost. During this time, 3 or more of the following symptoms must be present and represent a significant change in usual behavior. Inflated self-esteem or grandiose ideas, like I'm President of the United States, that kind of thing. There's a decreased need for sleep. They don't have to sleep, they can stay up for days. They're very talkative, racing thoughts, distracted easily, increase in goal-directed activity or psychomotor agitation. They're just constantly moving, especially during that manic phase. They engage in activities that hold the potential of painful consequences. Um, they go on those buying sprees unrestrained. So it's really usually easy to find somebody who's manic, but keep in mind, if they don't tell you everything they're taking, it might be hard to figure out because there could be some medical conditions doing that too. And we always rule out the medical. And I always talk about, I like to blame everything on the thyroid, but usually somebody with an overactive thyroid doesn't stay out for days on end. However, we still got to rule that out. You never know. There might be somebody that does that. The other thing is THC could cause it. They're not sleeping. That could cause it too. And all of a sudden they just get manic. There's a lot of people that do get manic with THC. So a depressive mood, the depressive part of bipolar. 5 or more of the following symptoms in 2 weeks to be diagnosed with a major depressive episode. Depressed mood most of the day, nearly every day. Little interest or pleasure in doing anything. Significant weight loss or decrease in or increase in appetite. Engaging in purposeless movements such as pacing, fatigue, or loss of energy. Feelings of worthlessness or guilt, diminished ability to think or concentrate or indecisiveness. Recurrent thoughts of death, recurrent suicidal ideation without a specific plan or a suicide attempt. So it's similar to just somebody that has just the depression. So we're going to be able to see some help with the there's a couple of different types of bipolar disorders. Here this one's easy. There's the manic phase, there's the depressive phase, and you can kind of see like different things. We talked about depression a lot, but basically the high or the low part. Types of bipolar disorders, there's bipolar 1, usually when you're looking at the manic and the depressive disorder. And you can either have it with or without psychotic episodes. So the psychotic, remember, they just really go off. They start seeing things. They start thinking things are there. Bipolar 2 is just depressive. It either consists of all depressive or manic. They alternate. They're typically less severe. They don't inhibit function. For the most part, with the bipolar 2, it's mostly you're going to see more depression, like treatment-resistant depression. Cyclothymic disorder is cyclic again, and it causes brief episodes of hypomania and depression. So their mania is like at a lower. All right. So let's talk about bipolar 2 for a sec. Bipolar 2, we have the person's mainly depressed. Possibly THC and or CBD may be of assistance in lowering the depression while not increasing the hypomania to the extent of concern. Possibly, not definitively, possibly. They did research with, again, the 2 to 3 grams of smoked THC daily. The other thing they did is they had another group with CBD 1 milligram per kilogram per day, but a max 600 milligrams. And it was a tincture per day. And they found that there was actually some assistance with, about half of the patients that were in the study. The THC must be less than 10 milligrams to prevent paranoia and psychosis. So that's real important too. Once you start going over the 10 milligrams, like when we're using the oils and the tinctures, then what happens is people just start seeing things and everything else. So we have to keep it less than 10, especially with somebody with bipolar, because that just makes them go off. So these are the bipolar people. Check with your healthcare provider again. Go slow, 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 slow. And again, over here, the manic is the elevated high, racing thoughts. Depressed is very empty, down, zapped, can't do anything, negative thoughts. Not the person that, not a lot of fun to be around. Here we go with our monitoring again. So bipolar 1, avoid THC and CBD as cannabinoids tend to increase mania and or increase insomnia to the point of not needing sleep to function. And they act so high, it's not funny. They're already high just inside internally. The mania, much less being on THC or CBD. So once we know that bipolar is in a family, I have a tendency to say, hey, you don't want to do THC or CBD. When I know that this person, if they don't have a diagnosis, we're like, oh, they're just depressed. Okay, we can handle that. But it's when you get that questionable. will be honest, I have a patient right now that's questionable of being bipolar 1. He's not been diagnosed, there's nobody in the family, but we're going to be approaching that tomorrow. So the med interactions, again, are the kind of similar thing. Increases the additive effect, respiratory depression, they could wind up stop breathing. So there's antipsychotics like Seroquel. The other thing is Seroquel, Spiridol, Zyprexa are the top 3 antipsychotics. There's lithium, which is in a class by itself. There's lamictal, which is actually the anti-epileptics, but we use them for people with the anxiety, depression, and so forth, and lower the dose of the antipsychotics or the lithium or lamictal if they're taking it. If you have any questions, direct your questions to your healthcare provider.